All right, Ben, what do you want to talk about today?
Well, Bob, we're going to talk about tennis elbow. Technically,
Lateral epicondylitis.
yeah, tennis elbow is a little easier to say, makes a little more
Right.
sense. People playing tennis, the backstroke is where it comes from, not the front stroke. I'm not a tennis player or whatever that's called, but it's on this side of the forearm. This would be the palm side. We're on the back side, and it happens right where these muscles connect to this bone. That's the lateral epicondyle. I would highly recommend getting a strap.
Right.
Okay, there's a tennis elbow strap, is what they typically call them. They make a lot of different
There's a lot of
styles.
variations.
So, what I would always recommend for myself as well as patients is you're going to put it not over the point
Right.
painful spot, but just
Just
distal.
a little bit towards the hand.
Right. And then when you're going to start using something, then you're going to tighten it up and it's going to disperse the
Right.
pressure. But
Puts more of the pressure here than on the bone.
exactly into that muscle belly. If you want and it's really sore, you can put a cold pack on
Right.
there for.
Always helps.
Yep, that's always a good option. Now, the main treatment of the day we're going to talk about is I don't even know if I need to sit here. Get yourself
You need a butter
a
knife.
butter knife. Okay, and it's got some round ends. We're going to use the handle of the butter
Right. And
knife,
not the blade.
not the blade. So forget about that. You're not going to use a regular knife,
Right.
something that you can go like this and you do not cut yourself.
Right.
Okay, get yourself some any kind of cream
Right.
that is moisturizing cream. Doesn't matter what it is, and we're going to use that for a lubricant. Okay, now we're going to take the knife, and here's that painful spot.
Again, handle.
Yep. And we're gonna go not on the bone. It's gonna hurt if you go on that painful spot.
There's the bone right
Yep.
there.
So I'm gonna go just distal or a little bit away on the muscle belly.
A little bit towards the hand.
Yep. And I'm gonna do this motion. This is if you're like from the north and you got snow, this is like a shovel. If you go this way, we call raking. So we're gonna shovel. We're not gonna
Not
rake.
raking.
Yep. And you go like this and you push down, not really hard, but it's you're putting some pressure on it.
Right.